Hi, everyone. Welcome. So excited to have Denise Levy here. She's a world-renowned technologist, and she is helping us to ease the fears and anxiety that patients have when they get their test results. And we have Vicki, who is here with us today. She has agreed to share her test results and a little bit of her story. Remember, we're not here to give a diagnosis. We're not here to offer medical advice. All we want to do is provide some education to help you understand your test results better and help you to be able to come up with a great set of questions to ask your doctor so you have a more productive and satisfying conversation when your doctor is going over the results with you. I'm going to bring up the test results for Vicki. Meantime, I want to introduce Denise and Vicki and leave the floor to you both to discuss some of the nuts and bolts of the case as I bring up those results. Denise, you want to start?
Oh, well, we're going to look at our results, and it looks like there's a difference between back neurogenic claudication and vascular. So we get quite a few of these with patients with back problems that have trouble walking. So it looks like they said her ABI and flow look good, and it's non-vascular, which means that it's more likely neurogenic from her back. Let's see, what do we have here?
I'm going to bring it up just a little bit.
Yeah. I
Okay,
don't
so
see.
above the knee, it doesn't look like it says that there is no significant atherosclerotic plaque, meaning
No,
there's not a lot of calcium buildup in the
and
right
below the
leg.
knee looks good, multiphasic and monophasic. DP with monophasic waveforms. Okay,
And can you
so fluid
walk us through
collection
what
in the
some of the
popliteal
words mean?
fossa may be a popliteal cyst. If you have any arthritis in your knee, sometimes you get a cyst behind your knee, synovial fluid, but it all looks good. No doubling of, okay. And here are the velocities. They all look good.
How do you know when you're looking at these velocities, what
Well,
numbers are you looking for?
well, at least close to 100 with the common femoral inflow. There's nothing next to it telling me what the waveform is. I think in the interpretation it said triphasic, which is normal, 3 components of the waveform. So that all looks good. And then 23,107 on the right.
Yep, now we're looking at the right.
Now the distal posterior tibial is 286.
Yeah,
So
that's a
that's
little.
more than doubling the waveform. So there may be a stenosis there.
How does your
And
right
then
leg feel, Vicki? Because doctors, they don't just look at your imaging, they look at your symptoms. They don't treat on imaging, they treat on symptoms.
Right. And my right leg does feel worse than my left leg whenever I'm walking, and I have pain when I walk. Then it goes away when I stop.
Oh,
okay,
that's
So
and
good. It goes away when
how
you stop.
long
That's
do
called
you?
intermittent claudication.
So how
yeah,
long, Vicki, do you have to rest before you can start walking again? Is it 5 minutes, 10 minutes,
probably a good 10 minutes. I like
10
to try to
minutes?
stretch and just I don't usually keep walking. So I only walk till a certain distance, and then because my husband and I do daily walks, and we walk for about 20 minutes,
Okay,
maybe a
so
mile,
a,
and come
a
back,
good
and that's
thing,
when I
a
don't
good thing
stop.
to
When it hurts, I
do.
keep pushing it.
Uh-huh. Yeah, that's good. A good thing to do would be the ABI resting and then have you exercise for at least 10 minutes and then repeat the ABI to see if there's a drop in pressure. So this would
Right.
clinically diagnose claudication, which means that the stenosis is causing your muscle to cramp and not giving you the flow you need to your foot.
Right. Yeah, my
Uh,
primary sent me to a vascular surgeon, and he's the one who determined it was not due to any kind of circulation issues, and he wants me to see a neurologist. He thinks it's nerve related.
Neurogenic. But do we have an ABI test with you here?
I think so.
This is
Here
just
it is.
okay. So maybe this is it. Was it
Yep, this looks like it.
127, 123? Okay, one. And the toe is 6'9", which is normal. Toe 5'4", that's normal. Yeah, it looks like your ABIs are fine, but what I would have done was I would have done a exercise on you because you could be normal at rest and abnormal when you walk.
Yeah, can
Right.
you
Yeah.
talk about the difference in the testing, Denise? This is a great example of a case and describe what you're talking about. So, most people, when they go in for an ABI, you place the blood pressure cuffs on the legs and the arms, you're just laying down. But you're saying there's a step further. So, if there is claudication, when a person says they walk, they get a leg cramp, when they stop, the pain goes away. But in Vicky's case, it's taking quite a bit of time for
10
her
minutes.
legs to reperfuse, and that is a red flag for you. And so you're saying in those cases, it's good to ask for a follow-up test and describe that follow-up test and what makes it different from the first one, and how do you ask for it?
Well, I think if she came to me, I would, take a full history and find that she does have possible claudication. So I would ask Dr. Hill if I could exercise her. It's not much more expensive. It's not that expensive at all. And I would want to know what happens to her leg after exercise,
Mm.
because she could drop in pressure.
And
Right.
so
His
what would
suggestion was he's going to do an ultrasound of my carotid artery in February. And then he suggested I see a vascular, no, I mean a neurologist, I'm sorry, and that I
Uh-huh,
get a MRI of
uh-huh.
my back, but he didn't order one. Not, yeah, an MRI of my back, because I do have back pain too with all this.
Oh, you do. Uh-huh, uh-huh.
Hmm.
And with
Well,
patients like this, that it's a lot of times it's a combination of things, and it's really hard to tell one from another. But really,
Right,
that cramping when you're walking that doesn't go away right away, that is a fairly textbook indication of PAD.
yeah,
right,
it would be good to get an exercise test. But then again, he may have been very confident in using just the resting pressures and saying that you're normal.
right.
Um,
But it's good to actually rule out the back issues as well, and then be able to, based on your symptoms, have
yes,
the doctors work together to determine uh, what's coming from what and what's leading to you feeling uncomfortable. Do you feel like the pain is getting in the way of your lifestyle? Are you, um, do you wake up at night due to any sort of leg cramps or other type of pain? When do you feel the majority of this pain?
Well, it's mostly when I move, but at night I do get leg cramping in my toes and in my calves. Sometimes I have to get up, and if I get up and walk a little bit, it seems to go away. I know it sounds the opposite because when I walk outside, but it has to be for a certain amount of time before the walking causes pain, if that makes sense. So I
does it?
guess, can you have both? Can you have something vascular and something with your arteries?
Well, that's possible. Do you
Neurogenic.
have any smoking history?
Yes, I did smoke for, God, from the time I was 16 till 34 when I was pregnant with my son, and I haven't smoked since. So it's been quite a few years
Okay,
since I've smoked. I'm 72.
okay. And any diabetes at all?
No, my blood
That's
sugar
good.
levels are pretty good. I have a history in my family of diabetes. My
Uh-huh,
grandmother lost her foot.
uh-huh. Can we go down to the impression on this and see what it
Sure.
says? I don't know if he mentions, normal ABIs. Uh, okay, so he chose not to do a, exercise exam. And he did do the, arterial duplex. So I guess he feels comfortable, with that and that there's no lesions, but there's a possible tightness in the right posterior tibial at the ankle.
And so it's worth talking to the doctor about, right? It's worth saying, hey, you know what? I'm still having, maybe go get the MRI, see what it says, talk to the orthopedic surgeon. But I am worried about the rest pain because typically when someone that I've experienced, Denise, who has neurogenic issues and issues from their back, I know my dad is one of those, he doesn't typically get cramps in his toes from the neurogenic, from the back issues.
Mhm.
Is that something that you
Right.
find as well?
Oh, yeah. But in looking at her duplex, is there anything to fix? The the question is, there is nothing to balloon angioplasty or
Mm.
laser. Um, it's just the posterior tibial may have some disease in it. Um, and then again, I would want to do the exercise exam to see what you are at rest and then what you are at post-exercise, to see
So
if your
Vicki is,
pressures drop.
yeah,
Um,
Vicki, so is that helpful?
Yeah, it's very helpful. I have an appointment with my cardiologist who did those tests you're looking at.
Good.
It was actually my primary care that referred me to the vascular surgeon. So I haven't really talked. My cardiologist is so busy, he doesn't respond, and he lets the primary care take over any further order. And I guess I understand that Medicare supposedly a specialist can't refer another specialist. I don't know if that's true, but they all seem to send the referrals to my primary to do that, if that makes any sense. This is
Well, with
California, by
Medicare,
the
you
way.
shouldn't need in a general Medicare, you usually don't need a referral. So it depends, on your hospital system, and hospital systems may have their own protocols as well. And
all
so
right,
we always do suggest, getting a second and third opinion from different hospital systems just to see. But as Denise says, if you were in her hands, at least from what she sees based on what's there, right? That she's
Right,
not seeing anything that is alarming to her, but she
right,
is suggesting there is, there might be more to the story, and to ask your doctor for that follow-up ABI with exercise. And that could be a great second step. And then bring it on back to us and let's see what she has, what you have going on. But in the meantime, walking is always the best medicine. See if your doctor has a supervised exercise therapy program that you can get into, and also ask your doctor about proper hydration, because and proper supplementation, because those can also cause some of those cramps as well. So if they're worth checking on. But meantime,
right.
Denise, what are the key takeaways of this case?
Well, the key takeaway is the scan does not find any stenosis that needs fixing, at least above the knee. I would just want to monitor the stenosis by your ankle. Um, and the MRI will show if it's neurogenic, if you have
Mm,
stenosis in your spine.
right, right. That helps a lot. Thank you.
thank you. Vicki, let us know how your appointment goes later. We appreciate you.